I'm very pleased to be a cardiologist because actually to become one, it was quite competitive in my time. So I'm very fortunate to be here, something I really love. And the reason why I love cardiology, having gone into it and now spending some years doing it, is because you are the diagnostician, so you make the diagnosis, you're the clinician, you then do detailed imaging, which is my area of specialty. You clarify and fine-tune the diagnosis, and then you decide on the type of intervention. And the intervention sits in our hands. So we've not only the clinician, we're not only the ones making the diagnosis, we're the ones doing the intervention. And then you follow the patient up afterwards. So that's why I love it, because you get closure very rapidly. You see the outcome of what you're doing to your patients. And so it's probably the fastest, in my opinion, the fastest moving specialty. And you're forever learning and innovating and moving forward. So for me, cardiology is just amazing. My background, really, if I wasn't going to become a doctor, I was all set up to become something in art. I loved all sorts of, I love the idea of creating things. So I was very artistic in my own way. And so to me, hand-eye coordination and fine-tuning, that just comes naturally. So I was going to be a surgeon. I got there, started my training, and then I realised actually I like the interaction with the patient. I like the discussions that you have. And actually, what's more important to me is not doing something that works well, necessarily, but actually it's about the interaction with the patient, finding out details about them and actually understanding what they need and what they require, because it may not be what I think I can do as a doctor. And then at the end of it, building that relationship up such that you've kind of answered all their questions and helped resolve issues, which may not actually be doing anything for them. So for me, cardiology was brilliant because it was hands-on, gave me all the thinking that I'd love to do, but at the same time had that clinical contact with the patient, which I think is the most precious thing for me. I love that the most.